to Daniel Naujoks, and he will present on multilateralism for mobility.
Good morning or good afternoon, everyone. It is a distinct privilege and a pleasure to share the days here with many scholars and colleagues I admire. And I'm impressed with how Ibrahim and Jeff were able to pull this together, this very short, this book in a short time, but with very high quality outcomes. And I thank all of you who are online right now. I know there's so many things you could do instead you spend the time listening to our flash presentations. In the next 5 minutes, I'm going to run you through my chapter, which is on multilateralism for mobility, cooperation among UN agencies in a post-pandemic world. And 1 second, there we go. So the UN, in Antonio Guterres, Secretary General of the UN, said at the Security Council in September this year,
pandemic is simply a test of international cooperation, a test the epicenter made.
So that is what Antonio Guterres said about the world's response, the UN Security Council. But as we all know, those of us who work with the UN is much less homogeneous. It's a very fragmented field with many different agencies and platforms and entities that work on a multitude of aspects of human mobility, displacement, refugees, and migration. And in the next few minutes, I'm just quickly running you through the key structural factors before COVID, during and post-COVID. And if you're interested in cooperation more in general, the chapter also offers a framework on what international cooperation means in terms of how often, in what ways, at what levels, on what issues, and with what agencies cooperation can work. There are two buckets of structural factors that were in place before the pandemic hit us. The first are in general, cooperation in general, the 2030 agenda on the SDGs, the current or the recent UN development reform, the changed funding environment, and the humanitarian development nexus and the new way of working, which all increased or are structural factors in favor of more interagency cooperation. And then there are a couple of factors that specifically talk about or that have a positive impact about cooperation on mobility, such as explicit focus of the SDGs on migration, several regional refugee migration response plans that enforce cooperation, of course the global compacts for migration on refugees, which provide an important platform for more collaborations and partnerships among UN agencies and other partners. The UN, of course, became a UN-related organization in the lead-up of the process that led to the global compacts. And the formerly Global Migration Group, GMG, was renamed UN Network for Migration, with important structural changes at Secretariat at how funding is operating, including the Migration Multi-Partner Trust Fund. So all these areas increase factors that increase cooperation. Let me also just tell you in 1 minute about a research project of mine that I'm doing on UN development plans. I actually have 500 development plans, all development plans of the UN in all the countries where the UN is working, and the vast majority of them include mobility, though in different ways. So this is just a very short illustration about there's different ways how the UN development plans actually do include mobility. But the key idea is that migration and displacement and refugee issues are very important for cooperation at the country level. So what happened during COVID? During COVID, we saw a large extent of mainstreaming mobility into the response and several joint project integrated programming. I'll give you two examples. In the COVID, in the policy brief by the Secretary General Antonio Guterres, the SG highlighted 4 key elements. Exclusion is costly. The COVID-19 response does not have to come at the cost of protecting the human rights of migrants. Importantly, no one is safe until everyone is safe. So again, that is a huge argument in favor of incorporating migrants with or without documented status into the response. And the last is that migrants and people on the move are part of the solution, be it through remittances, be it through healthcare workers, etc. Another example is the Global Humanitarian Response Plan, which in total aimed at raising $6.7 billion US, of which 1.5 billion were reserved or earmarked for regional refugee and regional refugee migrant response plans. And there are several other mentions, including a migration health evidence portal for COVID-19. And again, it's a general humanitarian plan in which migration mobility is highly integrated. So I give you one last minute on my reading of the crystal ball for the future. So how does the future of the post-pandemic world look like? And there's two buckets of factors. One is increasing cooperation and one may decrease it. So let's talk about the increasing first. There will be increased mobility needs because of poverty, because of structural factors that had nothing to do with mobility before, but with demand for labor. There are positive mobility perceptions of essential workers, of healthcare workers, that may increase our attention to mobility. There may be a stronger focus on multilateral solutions overall, and we've seen this. People have said COVID shows that we cannot cope with these solutions by ourselves, but we need more multilateral solutions. And of course, if we reform healthcare systems and other systems, this provides an opportunity for integrating migration and into agency cooperation. We also have several factors that limit cooperation, such as the global recession and reduced funds that may reduce the funding available and hence the budget of the UN. There are other priorities, an increase in extreme poverty that may detract from something that is maybe less a priority, such as mobility. Or we have negative perceptions of mobility, such as they convey, they bring disease. And sadly, of course, we have an increased nationalism and withdrawal from multilateralism, such as we've seen in the US under the still current administration. So I don't offer you the last bit of wisdom about what will prevail. My own hope, and I'm always an optimist, is that I see the looking at the historical factors and what we've seen during the pandemic, that in all likelihood we will see a stronger focus on international cooperation at the regional, the global, and the national level on mobility. But I look forward to your questions. Thanks for your attention. I look forward to my other colleagues' presentations.
Thank you, Daniel. I want